I've been in touch with your department for months on behalf of a gentleman by the name of Cody Flint in Mississippi. He's an agriculture pilot in Mississippi, and Cody received his first dose of the Pfizer vaccine on February the 1st, 2021, and immediately began experiencing very adverse side effects such as headaches, vision and hearing issues, dizziness, loss of balance, and a lot of pain. Due to these serious health issues, he has not been able to fly as an ag pilot since receiving the COVID vaccine shot, rendering Cody unable to provide for his family as an ag pilot in Mississippi. For more than a year, Mr. Flynn has been painstakingly going through the Countermeasures Injury Compensation Program, seeking compensation he may be entitled to based on his experience. And I've worked with him to try to navigate this process, and I've been stunned not only by your agency's lack of urgency in refusing such claims, many claims, but also the lack of the transparency in that process. And I certainly still advocate for the vaccine, and I myself received the vaccine, and I encourage others to speak to their doctors about receiving it. However, as with any new medical product, some people they will have side effects. The CICP exists for that very reason, and I'm very concerned about the amount of time it takes your agency to process claims and the lack of clarity given to those folks who were adversely affected. Can you tell me what you're going to do to address the thousands of claims currently in backlog at HHS, and what are you doing to improve the transparency of the CICP process so that Americans like Mr. Flint are properly compensated in a reasonable time period?
Senator, well, you've asked a very important question, not just to Mr. Flint, but to so many Americans who did what they should, which is to get vaccinated. We are finding that there are a number of Americans who are suffering from what we're calling today long COVID, and we are doing everything we can to make sure we provide them with the support that they need to get through this. Who knows how long it may be. We're doing research on this as well. I will say this, transparency is important. Accountability is important, and we want to make sure that those who really do have a medical issue to report are the ones who are receiving the assistance. We, as you're aware, in some cases, some of the COVID money has been used fraudulently by many. We want to make sure that no one's trying to game the system to get relief for something that doesn't exist. That way we can reserve the funds that we have for people like Mr. Flint and provide him with some help. And so why don't we do this? I'm more than willing to have my team reach out to you, and we can see about Mr. Flint and where he is in his process, because we have heard this story on many occasions. We know that millions have been saved because of the vaccine, but we also know that many people are still suffering, so we look forward to working with you.
Yeah, he's totally lost his income, and the financial burden is just unbelievable. But the frustration of trying to just get some answers of when something could be done for him for this compensation has been very great. Thank you for your help, and thank you for answering my questions.
Thank you.